and as little regard as they do the providers.
I realize that.
I mean, and the problem is, you're right, but if we don't accept them, if we don't work with them, then they'll cut us off, and we won't get any of the pay, we won't get any of the insurance patients. They'll take you off their list. Just like the Medicare, Medicare Advantage is a managed care for Medicare. So basically, you get some perks. You get like the premiums. There's maybe no premium. You get breaks on your medication. You get like a free trip to exercise. But the problem is you've got gatekeepers. So what happens in the managed care plans? They cut down the number of specialists. So about 2 years ago, United cut down on the 200 specialists off of the St. Louis market. Now they said that's not going to make any problem with you getting care. Of course it is. Because in order for managed care, you have to go through your primary, get a referral from your primary to the specialist. But if there's one orthopedic surgeon who does the case, that kind of cases in St. Louis, you have to wait for that one orthopedic surgeon, assuming they haven't cut them off, because they just knocked doctors off their networks. The insurance companies,
how can we fight this?
Well, that's what we have to fight.
I mean, I want the insurance company out of my doctors. I want them out of me and my physician's decisions as to what should happen to me.
See, that's what the whole irony about the ACA is they act like the government is in your medical care, and they're not. I mean, if you're Medicare, you don't need a gatekeeper. If you have a bad knee, you go to the orthopedic surgeon, you don't have to go through your primary. The problem with your Medicare, you also have to, since it only pays 80%, you have to have 20% for the Medigap. So that's expensive. But I mean, what I want, people like me would like to have Medicare for all, enhanced Medicare for all. And we could actually prove that we could save money, because Medicare right now operates on a budget, administrative budget of about 3%. I mean, you call Medicare, first of all, the forms are pretty easy. You file a claim. In 30 days, if it's a clean claim, you get paid. They don't quibble with you or say you didn't dot the I or you didn't cross the T, or they don't tell the patient that it's the provider's fault and tell the provider it's the patient's fault, so at the end we end up hating each other.
Mm-hmm.
I mean, insurance companies play games because, there's money in it.
Mm-hmm.
And nobody knows truly how much the profit is in insurance. But we know it's there.
Oh, it's
why do these
huge.
CEOs make so much money? Stephen Helmsley, makes $20 million a year. It's ridiculous.
Mm-hmm.
And trust me, it's not going, to physicians, because we basically are on a fee schedule. And we've accepted the fee schedule. Every year Medicare publishes a fee schedule. So everything we do is defined by a number. It's called the CPT code. So say I'm a pathologist, so I look at a breast biopsy or a biopsy of anything. That's an 88305. That's on a published fee schedule, and if I'm enrolled in Medicare, I agree to accept it. And insurance companies are not that. Insurance companies theoretically are supposed to pay like a multiple of Medicare, like 1.25. But the problem is, with what they do to the providers, is they cut down on the rates. So as you're going along, if you look, it's like, what happened to my pricing? And they just can change it arbitrarily. They don't really. They have no regards for any of us. And I hate to say that, but it's the truth.
Well, what do we do to fight this?
Well, we have to keep fighting it. That's why now, we have to fight. Okay, right now, like I said, we've got to fight for the ACA, or we've got to fight for something. And if fighting for something, if we could get these guys to understand that, they want to be fiscal conservative, they could save money with Medicare for all. Because, like I said, the insurance companies have anywhere from 12 to 30% administrative costs. The ACA, part of it was they were supposed to say that they were sending more than 15% of your premium on administrative costs. But, how do we, what they wanted to describe as an administrative cost were advertising. So when you become 64, and you're a good, healthy 64-year-old, going to be 65, they want you in their managed care plan. So they take you out to dinner, and it's not because they like you, because what the managed care plans in Medicare want to sign up healthy seniors. The managed cares for Medicare were created under the Bush administration because it was his first effort to try to privatize Medicare. Because Medicare's, the conservatives do not like Medicare. They don't
No.
Many of them do not believe that the health system.
Although
is
it's
right.
helped them in their childhood and their parents and things like that.
I mean, partly you have to believe that healthcare is a human right, but so many people in the United States think you have to earn it. But they're naive enough to believe that you only get sick when you deserve to get sick, or you only get poor when you deserve to get poor.
I know, I've got people that are actually looking at me and saying, well, don't you bear some responsibility for your back?
I mean, it's like, and being a physician, I know that the nicest people who work the hardest and do everything right can get sick. I mean, there's no guarantee. That's why the one thing you should have, I mean, I would hope that having a healthy country would be what you want. I mean, if you're going to send kids off to war, you want them to be healthy. If you're going to have kids that are going to be productive and grow up to be good performing adults, you want everybody to be healthy. And if anybody who's so naive to believe that if you have an epidemic, just because you have money and good health care, you're not going to get sick. Epidemics cross all lines.
Yeah.
So you really have to, the whole society is only as good as the weakest of the people. Well, I'm just going to, okay, this was the letter I sent to Rodney about, Mr. Davis, or Congressman Davis. I sent him a letter about the ACA. Now, the only reason I was going to read these to you is since he's not here, I'm putting words in his mouth. Because these were the words he put on a paper and sent to me. Dear Dr. Hormeyer, thank you for contacting my office regarding your support for single-payer Medicare system. It is important for me to hear from my constituents, and I appreciate the time you took to share your thoughts. In addition to me contacting him, I sent a letter that was written by the President of the American Society of Cardiology in 2010, and it was entitled, I'm a Republican and I'm for single-payer health care. I mean, this was a cardiologist, which is a very highly paid specialty, who's a Republican from Texas who realizes it, because many doctors now realize that we don't like the insurance companies, and we want to take care of our patients. I believe we must pass health care reform that lowers and contains health care costs. Washington needs to compromise and come together to fix the disaster that is Obamacare and our flawed health care system. I support solutions that would implement meaningful medical malpractice reform and increase competition by allowing people to purchase insurance across state lines. I also support expanding access to health savings accounts that individuals can use on their health expenses. Furthermore, we can protect those with pre-existing conditions by strengthening state-based risk pools. I understand your solution to our flawed healthcare system is to implement a single-payer Medicare system. I know we may not agree on every issue, but know that I appreciate you contacting me with your desire to see our country adopt socialized health care, and Medicare for All is not socialized medicine. Medicare for All is publicly funded, privately delivered. It's not socialized medicine, which is what the National Health System in England is, and that's not what we're proposing. No matter our differences in view, members of Congress must come to the table, exchange ideas, and pass true health care reform. Again, thank you for contacting my office. Please let me know if my office can be of assistance to you in the future. If you would like to stay informed of what's happening in the 13th District, I encourage you to sign up to receive my e-newsletters. And he gives this where I'm supposed to contact him. And okay, that was the second letter. That was after actually, it wasn't the second letter, because that was the second letter I received, because I first sent him the letter about the physician who supports the single payer, because I thought, if they're trying to figure out what they can do with the ACA, just go to single payer. But he didn't answer that letter till I got the first letter. Okay, the first letter was, thank you for contacting me regarding the Affordable Care Act. I appreciate hearing from my constituents in my district and the time you took to share your thoughts. I understand why people are anxious with the repeal of Obamacare. Change breeds concern. Please be assured that I want to make health care better for all, and I value your input when making decisions in Washington, D.C. The American people were promised the ACA would provide expanded care coverage at lower costs. To reach this goal, the plan required enrolling younger, healthier individuals to balance the costs associated with older, less healthy individuals through use of the individual mandate. In 2010, the CBO, the Congressional Budget Office, estimated that by 2016, there would be 21 million individuals enrolled under the ACA, but last year, only 13 million individuals enrolled. Unfortunately, this plan has failed. The failure has led to 1/3 of all counties in the United States having only one insurer participating under the ACA. In Illinois, premiums for the lowest cost plans will rise on average by a staggering 55%. Additionally, there are roughly 30 million Americans who are underinsured, meaning their insurance plan is deductible that they cannot afford to reach. Please know that I support simultaneously repealing and replacing the ACA. Republicans are working on developing their plan, which we're supposed to be seeing coming soon. We haven't seen it yet. But what you can see, and if you look at that form that I gave you from the nurses union, you can see that what Rodney is harping on is the ideas they're coming up with for replacing the ACA. I mean, the idea of the ACA is you get everybody enrolled, so you increase your risk. I mean, you dilute it out because you have younger people and you have older people, and we share the risk. Okay. Now, the thing that they keep blaming for the ACA for is the fact that employers are changing our plans. I have to tell them that there are many employers who wanted to change their plans long before the ACA, because we backed into the employer-based health care after World War II when there were controls on how much you could pay people for jobs. So the way you could get people to come was you offered them good health care plans. So that's how we backed into it. But gradually, there are many employers who don't think that they should have to pay for health care. The irony of it is the way I'm a small business owner. I consider the money I pay for my employees' health care their salaries. I mean, unfortunately, when I pick a plan, I'm deciding how they're going to spend their money, but I try to pick a plan that makes sense and that, that actually gives them, I try to get the lowest deductible and the lowest copay. Because, I know all those costs add up. But they're blaming them for the fact that, because, Obama made the mistake of saying, if you like your health care insurance, you can keep it. Well, it wasn't up to the people, it was up to their employer. And the employers are backing out of it because the costs are getting so high. Every year when I have a small business plan, I have only 8 employees. And I was seeing rises in my premium at 16%. Every month, I was I guess at one time I had 7 people, including myself. I was paying $120,000 a year for health insurance for my employees. But, that's not my money, that's their money, that's their salaries. And if I quit giving them health insurance, I think I should raise their salaries, but not everybody feels that way. So they're blaming Obama for the fact that the employers are backing out of health care plans, but that was going to happen
Because
anyway.
the insurance companies are making it impossible for the employers to keep the
Right, and our health care costs are
So it all goes back to the insurance people.
because we have no way to rein in costs. Strictly speaking, Medicare reins in costs better than anybody because, it really does. And see, that's the beauty of a single-payer health care plan. You actually have some controls, over what you're getting. I don't really think we need to have 5 MRIs in, Maryville or 5 CAT scans when they, we don't need all that. The more technology, the more tests you offer, the more tests people order. And sometimes ordering too many tests isn't the right answer. There are so many things that we need to control, and we'll never control costs under an insurance plan. But Medicare actually has slowed the cost of healthcare costs. So Rodney, they're blaming the Obamacare for the flaw that you lost your insurance. They're blaming it for the fact that not everybody enrolled because a lot of kids still didn't want to enroll because they didn't want to, many young people think they're infinite or they're invincible. And they don't realize that tomorrow they can come down with something too because there are diseases that affect us all. So they didn't get all the people in the pool. And quite honestly, going to that, I don't know if anybody went on, did anybody go on?
I never could make heads or tails out of it.
It's horrible. I'm as an employer and a doctor, I have trouble sometimes picking out what plan is best for my employees. Trying to look at just, and people that don't know anything about their health, how much health care costs, it's almost impossible. That's why the ACA is so hard because it's just hard for people to pick out a plan. So Rodney, they're blaming that. They're blaming that not everybody got enrolled. They're blaming that we're underinsured, and we're underinsured because what's happened is the employers have raised the deductibles. So it used to be, most hospital employees used to have great insurance plans with low deductibles. But now, you know, they're up to $3,000, $5,000 deductible. And I mean, that's a lot of money to have to put out every year for your health care. So they're, okay, so what Rodney wants to do is his health savings accounts. They love this health savings account.
Yeah.
Then, I mean, and the trick of the health savings account is the money you stick in a health savings account, you don't pay taxes on.
But it's gone in one doctor's visit.
Where rich people could hide their money and not pay taxes on it. And and even if I gave my employees a $3,000 or a $2,000 health savings account, that would be gone in like, you know, that wouldn't even come
shots in my back.
So he likes the health savings account. He's harping on the fact that this thing about we need to have insurance across state lines. I mean, the reason that insurance doesn't go across state lines now is most of the insurance companies in the region have networks with physicians there. What you get is maybe in North Dakota where there's a plan that pays for nothing. Those plans that you used to hear about on the radio, for $100 you get all your health insurance. Those are plans that are not being monitored by any insurance administrators in the states. So you'd be paying money for basically nothing. But they love this thing about the fact that we have to go health insurance across state lines. And the malpractice reform, I mean, he's harping on the fact, I mean, I've been in Madison County since 1981, and we know that in Madison County we had a malpractice crisis where we lost 200 physicians. But that was, and where many people wanted to blame they want to blame the attorneys who defend people who have been injured in malpractice, or the jurors, because the jurors are not smart. But that's not true. I mean, we have actually pretty good, I mean, if anybody's looked at the malpractice cases that have come to trial in the last 2 years, I don't think there's been one judgment against the doctor. Because most people understand that it's a hard job, and sometimes mistakes do be made. But you can't, and the insurance companies, when we had the crisis, had made bad investments, so they left because they weren't making any money on the malpractice insurance. So they left, and I mean, we were down to about 3 providers in the state of Illinois. But we've weathered that storm, and I honestly think that, you know, I mean, you can't get rid of malpractice. You can't get rid of them because there are things that are bad that need to be, I mean, that you can't pay for. I mean, that you can't make, you know, make a mistake, you need to admit you made a mistake. Now, if you had a single payer system, since we all get a card at birth, you wouldn't, in a malpractice case, you wouldn't have to pay. That wouldn't be part of the settlement, the fact that you'd have to pay for the ongoing medical expenses, because that would be covered by your card for Medicare. I mean, so there's many things that Rodney is just harping on, that all we can see that's going to be part of the plan. I mean, he wants to get rid of, right now, the way it's set up, the ACA. If you make up to 4 times the poverty line, you get a rebate on your taxes. If you go on the exchanges and get your insurance, you get money back to help you pay for the premium. Well, he wants to get rid of that. They want to base the premiums on your age, and not on how much you make, which means rich people could get money back for buying insurance. I mean, the whole thing is just not feasible. That's why so many people are protesting throughout the country, and these places where they've actually shown up for town hall meetings, like Marsha Blackburn in Tennessee, she got screamed at. I mean, they've all been getting screamed at.
Sheldon Whitehouse.
Mitch McConnell got it.
Mitch McConnell got it. Well, I love that.
Did you hear what she said?
Yes.
She said, the people here are poor, you know, coal's not coming back, and if you want to Elizabeth Warren me, I'll sit down and shut up. That's what she said.
I'll sit down and shut
Is
up.
that what Marsha said?
And no, that's what this lady said to Mitch McConnell.
Oh,
And
good.
if you want me to shut up, you can Elizabeth Warren me, and I'll sit down and shut up.
Well, see, Mitch McConnell he was at a Chamber of Commerce or a Rotary Club, and the people showed up. I mean, the thing is, and that's why we're reduced to having flat Rodney, because Rodney didn't respond to us. And I mean, I'll tell you, I was in Shimkus district until I live in Glen Harbor, they redistrict us. Well, Shimkus was the same way. I mean, you could only get, if you got an appointment with Mr. Shimkus in his office, you could bring 5 people in, and that's it. And the only time I actually got an audience with Mr. Shimkus, other than the one time I went to Greenville when he was having a mobile office. but the only time I got to actually sit with him with 5 people was after they redistricted me. I figured he was so happy that I was leaving, that he would finally talk to me in his office. So, I mean, okay,
Yeah, I want to ask you a question. Have you been reading any of the proposals that have come out from the Republican Party about what they want to do? Well, they don't want to call it the Affordable Care Act. They want to repeal it. I don't know what they want to call it. I guess they want to call it Trump Care. I have no idea. Have you read any of the proposals that they have?
well, yeah, that's what that thing was in the policy brief and resources from the New York Times, where they went through, and I mean, it's all the same, it's just catch terms.
That's right.
It's
Insurance is
housing,
available to
housing.
you. Well, insurance is available to everybody. It
Yeah.
doesn't mean you can afford it.
Exactly.
You know?
And I mean, we want insurance that's not tied to our, they say you could have insurance that wouldn't be tied to your employment. So, but the stick is, if you didn't get insurance for years, you would be no longer able to continue your insurance. I mean, there's a whole bunch of things that they're not meant to be for us.
They want to get rid of employers paying for health care insurance for their employees completely.
Right, I mean, but isn't that stupid? Like I said, as far as I'm concerned, that's part of the employee's salary. So if employers do that, they should increase their salaries. And I mean, I'll tell anybody that. I mean, I go up to the CEO or whatever and tell them, because that's the way I feel about it.
And you're talking about people that think that $7 an hour is too much. Okay?
That they want to wipe out the
So
minimum wage.
you can smack a fly with a fly swatter 100 times. It doesn't die anymore. You can't talk to these people about it.
When they say, shouldn't it be great that everybody can have insurance that moves with you wherever you go? So that's the thing of employers not paying your insurance. And when they talk about health savings account, what poor person can put $5,000?
Dollars in a house.
They can't, what can they say? And how can they even get a benefit off their taxes when they don't make enough money to pay taxes? I mean, none of it makes any sense. It's all just, and I mean, this thing about state line, I mean, they harp so much on state line. And then tort reform, what they want to do with malpractice reform is they want to get rid of it, just like they want to get rid of workman's comp. I mean, they don't care if you get injured on the job, so it's all right. I mean, if you're exposed to asbestos, you took the risk. I mean, but that's not the way, I mean, that's not a country that's caring.
Well, that's the reason why there's so much nonsense that goes on from 45. You know what 45 is, right?
Oh, yeah.
Okay. I don't like to say
That's
it.
what we're
so I
referring
call
to
it
as well, yes, 45.
Everybody is listening to what he's talking about, and it's like listening to a fourth grader. He doesn't have a very good vocabulary. People need to watch. People need to pay attention on what's going on in the Congress and the Senate, all right? Because you're trying to get rid of that the Consumer Financial Protection Bureau.
Elizabeth Warren.
Yeah, they want to get rid of
Oh,
that. And people don't realize that about 6 months ago, Wells Fargo was charging fees for things that people didn't even know they were charging about. And if you didn't have that agency, they would have kept on charging, that's what they want to do. And I read about the BAT on the taxes, it's a value-added tax. It's a border adjustment tax. They're going to reduce the taxes by 20% to the corporations. On the same time, anything coming into the country is going to be taxed at a rate of 20% higher. So if you bought another car yesterday from California, it was 50 cents, but if you buy one tomorrow from Mexico, it's going to cost you 78 cents. They're going to tax everything that comes into this country. All right, so you're going to give money to the rich and take away from the middle class and the lower class.
Wells Fargo was actually giving people credit cards so they had to apply for them.
Yeah.
And they were giving them checking accounts that they didn't even know they wanted bank
To me,
accounts.
those are the things that we need to watch. Listening to 45 talk is nonsense.
I want to know what he has to say about why none of those Wells Fargo people wound up even charged with a crime.
Because none of them do. They never do.
I know, it's, people bitch about Trump, which I'm not a fan of his, but by God, this shit was going on the whole time Barack Obama was in there too. He let him slide.
I mean,
one thing that's certainly not being addressed is that everybody's blaming everything on the Affordable Care Act, and insurance premiums were skyrocketing.
Yeah.
I remember a job back in 1991 where every single year they were doubling. So the company had to keep switching insurance companies. that was back in the late 80s, early 90s, was just when big
When the
business got
insurance
involved in
companies-
healthcare and started raking profits out of it, and it's.
That's when the insurance company took over the medical field,
What-
as far as I'm concerned, that's what they
yeah,
did.
what nobody's talking about is that the affordable care, I don't remember the numbers, but I did look it up in the last couple of days, is that the Affordable Care Act, in a lot of states, it was starting to stabilize.
Mhm.
And there were about 14 states, I think, if I'm remembering my numbers, that it had actually shifted around and was becoming profitable to the insurance companies. But they don't want to admit that, they don't want to talk about
Well,
that.
they
It was
have,
actually
they
working.
may pretend like they're losing money on the ACA theoretically, but they're making money in all their other
Well,
lines.
they might, like United, one of this article was talking about United Healthcare might have lost 820 million, but they made 10.6 billion in whatever. So it's all about profits. So that, no, that the Republicans have some kind of agenda about trying to sink it. It's probably about insurance lobbyists, but it was starting to become profitable. Even the state of Florida, Aetna pulled out of the state of Florida, not because they weren't making profit, but it was something about their merger with Humana, and so they were.
Right, they were gonna merge.
How can we,
Like, none of it's truthful, it's crazy.
Well, I was
how
trying
can
to-
we become like the insurance company have their lobbyists, the military have their lobbyists? How can we, the people, make lobbyists for ourselves?
We have to make our voices.
That's supposed to be-
We have
You know.
There's lobbyists
We have to go, we have to write him,
I
we
mean-
have to call him,
I-
we have to go see him when he doesn't want us to see him. We have to get on the phone and call Philip every day. I mean, because they said if you call your congressman, like, spend like 5 minutes every day calling your congressman, I mean, I don't know how else to get to him. I mean, either, you can stand in the streets and revolt. I mean, you can also try to do, if you could do things like the Krugerrands where you can take away and quit buying something, like if you quit buying Ivanka Trump's clothes, you might, but I don't know, but all I know, and that's why if you look at that Invincible, I think we're a new territory, but I think the beauty about the new territory is that we're getting more people who never realized how bad it was, because there's a group in Edwardsville, and the Metro East, and they started out as the Pantsuit Nation. Okay, and I'll tell you, I was a Bernie supporter. I ran as a delegate, and I was on the platform committee. Even though I came in second in the 13th, because the Illinois State Democrats set it up that it was man, woman, man in our district, the 2 men who actually got to be delegates got fewer votes than I did. But so they put me on the platform committee. But so the Pantsuit Nation was something that was created, I guess, in October to try to get to boost Hillary, I guess. And I never even heard of it till after the election. Because what it's become now in Illinois is Action for a Better Tomorrow. And I will tell you, I've been to their meetings. They're the second Sunday of every month. They were at Bigelow's Bistro, but now they're going to be at the Main Street Community Center, that thing on Main Street.
that was also
The second Sunday of the month at 1 o'clock. But I've never seen, these are people I've never seen get involved. A lot of them are younger women. And I know what people, it takes time to get involved. It takes time for me. To me, to come here tonight, I had to run around and do all my work, and then I probably have to go back to work. But it takes time, but I think it's gotten to the point that, and I think us being mad, we know that we know in the past, historically, that we've had to protest and protest and protest to get things done. But I think we're going to have to do it again. That's why they're having a protest every week, I think we need to get out in the streets and let them know we're not happy. And we also need to primary him.
Yes.
We also need
Definitely.
to find somebody
That's
who
exactly
we can
right.
get behind and vote him out. Because
Somebody
last time we
progressive.
ran, Gil only lost
Not a
5,000
corporatist.
votes.
We want
David
progressive.
Gill. Right.
David who?
David Gill, he was a physician out of
Yeah, I
Boston.
voted.
I was supporting Gill, but he only lost by 100,000 votes. But the other thing for that one, there was a third-party candidate, John Hartman, every time
Yeah,
I see
I
John
remember
Hartman
that.
later, when we had a meeting here when we had the guy comes from Move to Amend, and he at that time identified himself as a Republican. What he said he was a socially liberal and fiscally conservative. Well, he bled 20,000 votes off that election. But, I mean, we're a district that's a swing district. I mean, we can always count, Champaign-Urbana is part of us, and they're really more liberal than we are. But we need to get the people down here to get rid of this guy.
Yeah.
When is his next
Sorry, what?
cycle up?
He goes up for reelection next
In
November.
20 years, yeah, in 2 years. Congress is gonna run every 2 years.
Yeah,
17?
yeah, it's for 18, but the
2018. So people are already starting to talk about wanting to run.
Is Dr. Gill?
Well, the problem with Gill is he tried to run the last time as a third party candidate. I mean, when he ran and he only lost by 1,000.
I helped work on it.
And he got a lot of money from the DCCC, but he lost. Then the next time he ran, he didn't want to run as a Democrat, so he tried to get on the ballot as a independent. But the problem is all the independent's going to do is bleed somebody off. And they wouldn't let him on the ballot because he didn't have.
If they keep putting Democrats like Hillary up against these idiots, they're gonna get bled off, because I'm not voting for a criminal. I don't care if they're Democrat or Republican. I don't like the woman. I just,
Well, I think nobody listened to us about that when we went to the convention.
I mean, we tried to tell them we had the perfect answer for them. Somebody that was honest and had integrity.
I agree.
Would Gill run again?
He's talking about running, but he won't. I don't think he'll run as a Democrat. And I think the problem is he'd already run like 3 times before we became part of the district.
Oh.
But we can find candidates. We can find a good candidate, but we have to get into our Democratic Party. And I mean, this is a sort of a blue dog Democratic Party in Madison County, but we need to get into it to convince them, that
Yes.
we need to find good candidates. There are some people in the Democratic Party here who do agree, but in general, they got so shellacked the last time. They're running scared. I mean, when Prenzler became is now the county chair, and this used to be a much more Democratic.
Oh, yeah.
Okay, so I think that we need to get the Democratic Party to be responsive. And the first thing that's happening is on Saturday, they're gonna vote on a new DSC chair. Now, it's Keith Ellison is the burning person, and Keith Ellison is a congressman from Minneapolis who was a Bernie delegate and a Bernie supporter. And he's running against Tom Perez, who was the Secretary of Labor, who actually the Obama camp likes him. But
Because
the
he's a
problem is
corporatist.
Perez has never run as far, he's never had any elected offices. So they're gonna vote on Saturday. The theory is that if we need to make the party listen to us.
That's right.
And I went to that convention, and I left after the second night. I couldn't go to the third night. I couldn't take it. I went to the Black Men for Bernie party, and then the fourth night I left because it was awful.
I've been a Democrat for over 40 years, and for the first time in my life, I voted green this last election. I just
Well, I don't think they listened to
couldn't
us.